Morning, everybody. Dr. Gabriele Jasper, MD, interventional pain. That's what I do, interventional pain.
That's right.
And I always got to tell you what that means. It's not pain management, because people think pain management means treating of pain with pain medications.
Yeah.
And we don't do that. You know, if I can prescribe pain medication if I actually do a procedure that causes some pain postoperatively. And they really don't cause much pain postoperatively, but just in case somebody has a low pain threshold,
Sure.
give them a little bit of pain medication. But what do? I am somebody who tries to get rid of the pain generator. Find a pain generator, get rid of it. That's the key. You got to be able to read MRIs. You got to be able to correlate your MRIs with the patient's symptoms, clinical symptoms. And it's not that difficult, especially if you've been doing it for a long time and you know what you're doing. And I happen to know a thing or two about a thing or two. Oh, I just wanted to say that I like to, this is a tribute. I'd like to dedicate this today to Paulie Walnuts.
That's right.
Paulie Walnuts had died about a week and a half ago. And, you know, his name is Tony Sirico. Sirico. And so much to donate, I mean, to attribute, I just wanted to show you my hair that I fixed today just for Tony Sirico. There it is.
Yeah.
See right there? That's it. Look at that. Of course, he probably had a little bit more hair than I do.
Yeah. If you're listening to us on podcast, he's got the white stripes on the side of his head, temples.
All right. I don't quite talk like him, but you know, I'm a Passaic guy from Passaic, New Jersey. Sometimes it sounds like that we're definitely a New Jersey accent, but I've been all over the world, so I kind of lost that a little bit. But living down here, I'm picking it up again. Anyway, what do? I do things like epidurals. That's our standard thing that we do.
It's sometimes it helps people and you never see them again, and sometimes it's also a diagnostic tool, right?
Yeah. Somebody asked me the other day, Doc, isn't this a Band-Aid? It's not a Band-Aid. It has a lot of functions. Number one, it could get rid of your pain permanently,
right?
Unless you hurt yourself in the future or something goes bad and you're back in the future, but it's nothing to do with what actually we treated.
Yeah.
And how does that happen? Epidurals, it decreases the inflammation of the nerves. The nerves that usually have, cause you to have sciatica, hip pain, groin pain, stuff like that, depending on what level it is. And that's my job to find out what level.
Right.
And if you're able to shrink that nerve, because inflammation is swelling and pain, if you're able to shrink that nerve down to the normal size, you have relatively more room, because these nerves find themselves in tunnels, neuroforamina, central canal. These tunnels are limited by space, by their bony structures that surround it, that make up the tunnel. Sometimes you have things that occupy the space in that tunnel. For example, you can have a herniated disc, which protrudes and puts pressure against the nerve, which puts the nerve up against a bony structure, and that hurts.
Yeah.
That's a pinched nerve. You can have arthritis of the spine, which I want to talk a lot about the arthritis of the spine and how we can treat that today. But arthritis of the spine, you ever see anybody with swollen knuckles? That's what happens in the joints in the spine. They swell up to the neuroforamina or the central canal, causing stenosis. Stenosis is a tightening of a canal, putting pressure on the nerve. So now you got somebody with a herniated disc. They call it hypertrophy of the facet joints, which is swelling of the joints. And then we have degenerative disc disease. The discs actually get smaller, so the roof and the floor of the tunnel get closer together. So it just closes down on the nerves in that area. My job is to decompress the nerve Now, you can decompress the nerve directly by opening them up and taking the bony structures out, taking the herniation off, and also degenerative disc disease with swelling of even the nucleus, not the nucleus, the annulus, which you could trim that down. Now, I do all this with very small incisions. Actually, the size of the incision is a 4-millimeter incision, and I can stretch the skin out to put an 8-millimeter scope in it, and I'm looking at a high definition monitor TV screen. People who don't know what monitor means. I'm sure I have some people watching that don't know the technical terms of
a television screen.
And when I say high definition, I mean it's like looking into a fishbowl, a clean fish tank.
Oh, like you can step right through the screen. It's one of those everybody, has got in their living room. Yeah.
And you can see everything beautifully. You can see the neurovascular structures, which is very important.
Yeah, but imagine blowing up something so small into something where you can actually make sense of it,
and it's up on like a, 40-inch screen.
Yeah.
Instead of being the whole area that you're working in is probably less than a centimeter.
Right.
I mean, you got the 8-millimeter scope in this small area, looking and dissecting and taking down and basically decompressing all the nerves in the center of the canal.
But like the slightest move of your hand, I mean, you have to be very skilled.
Anytime
right?
you make a move, it should be a purpose.
Yeah,
move,
yeah.
But I mean, you got to know what you're doing.
Right.
You're not in there with anything real sharp that's going to destroy anything most of the time. And if you are in there with something that will create a cavity, decrease bone structures, and these things, by the way, like I can go in there with a diamond tip drill and shave down some of the bone spurs. And these are designed that if you bang up against the nerve with it, it's so smooth, it's just going to push the nerve away.
Right.
That's how they're designed. I mean, if you push it up against it and smash it up against a bone, you're going to have problems.
God bless.
So you got to know what you're doing. You got to know the anatomy. And this thing is bothering me. All right, there we go.
There you go.
Anyway, so an epidurals work. And if they don't work, they become a diagnostic block. They could work if you give somebody an injection at a specific area that anatomically or pathologically on the MRI, you see something, and it goes down the leg in a certain direction, a certain distance, you can figure out what it is. And if you give an injection and the injection works for 2 days, it's not magic. That means that's the area that has the problem. And if it comes back, that means the epidural didn't work. However, it did tell you that that's the area because you're 100% pain-free for 2 days.
Right.
So now this means that there's just not enough room in there for the nerve. So what do? You go in there and you open up the area, decompress the nerve. And what I do is I avoid sending people to get major surgery.
Right.
And if somebody needs major surgery, I'll be the first one to tell them. But you have to go through these steps first. Now, sometimes people surprise you. And you think this person's not going to get better no matter what I do. You give them a little shot, they come back, they're 100% pain-free. Like, where does that come from? And they ask you, well, how long is it going to last? You don't know. You don't know because everybody's different.
Yeah, but I noticed there's always one thing you say when something like that happens. You say, thank God.
Thank God it happened.
You always do.
Yeah.
You always thank God when somebody did better. You say, thank God.
I do these spacers, right? And I want to talk about a few of the success stories. And pretty much all of them are success stories. Very rarely it doesn't work. Things don't work. Whether it's 30% or 100%, 10%, 20%, whatever it is, it's going to give them relief. Of course, you like to have 100%, but a lot of times, people have bad back with multiple pain generators. It's hard to get 100%. But not this Monday, the Monday before, I had a patient that had four level moderate. One of them was severe central canal stenosis, and that's spinal stenosis. It's spinal stenosis. This guy could not walk from the car to my office when he came in. I gave him a couple epidurals. He had to go to physical therapy to see if any of the conservative stuff works, which didn't. So I treated the most worst level. And I was convinced that I got to do in the future the other 3 eventually. That's what happens. But he came back that Monday so happy. I think you even did a testimonial, which I wanted to.
Oh yeah,
that I wanted to
actually
see. It should be on YouTube or something like that.
Yeah,
But he was 98% better. He told me yesterday he walked 1.5 miles. And in the same breath, he says, when I met you, I couldn't walk from my car to the office,
right.
which is probably 100 feet or less. That was surprising and pleasant. I always say sometimes we're pleasantly surprised. He probably does not need any other levels done. And that's one of the reasons why we do 1 level at a time.
Right.
Because you might not need it. And, maybe if he lives long enough, if those levels that are not at the critical point, I call it, where the diameter gets smaller and smaller and smaller, it could get 1/8 of a millimeter tighter, and then all of a sudden they got symptoms. But you don't need much. But it could look bad and still not have any symptoms. I got that too. But anyway, that's those are a few of the things that I do. But what and I think I mentioned it last time I was on this podcast is the arthritis. The arthritis, especially in the younger population. When I say younger population, usually it doesn't happen till around 50, and it's genetic. This is very sensitive. You can hear him breathing on this thing. Hello, can you hear me now? That's better. Maybe a little louder.
Is that better?
Yeah, it's better. Anyway, so arthritis, especially in the younger population. The population almost get used to it. But while I'm treating them for other things, the older population, and I get rid of all the pain, they say, I'm like 80% better, but I got this pain in the morning in my low back.
Right.
Can you do something for it? Yeah, we could do something for it. And then you got the younger population of construction workers genetically predisposed to this type of arthritis. And it really affects the quality of people's lives, especially that pain that you get in the morning. This is not quite like spinal stenosis. Spinal stenosis, you don't feel much pain in the morning. It's when you walk. Right. You walk with spinal stenosis, you got to sit down. Once you sit down, you feel good. Right. With arthritis, it takes a little bit longer for that pain to affect you when you're standing up or walking. Right. And these are people who really don't have spinal stenosis. So, it's the source of the pain is the arthritis. And these are the people that sit down, and after a certain time, when they sit down, they have pain in their back. Spinal stenosis usually doesn't happen like that. You sit down forever and it doesn't bother you. Right. And then you have somebody who has a combination of the two. And this is what I fix. And this is why a lot of these patients do well. Yeah. You see probably some doctors out there that, eventually see one of my patients for some reason, or a few of my patients, and they say, look, you put in a spacer, you put spacers in everybody. I don't put spacers in everybody. I don't do the Minuteman or Vertiflex, whatever it is that you want to use. They're all good quality products. But there are a lot of people in Toms River, Bricktown area, and this whole general area that have spinal stenosis, no matter how you look at it. They say I put more of the spacers in than anybody else in the world. Probably if you go to a good spot, like in Naples in Florida, you probably won't find too many because they all have them in them because of me. I get them before they go down to Florida so they can enjoy their
enjoy Florida. Yeah,
enjoy their winter vacation. But somebody down there as a physician that knows how to put them in are probably just as busy as me. And it depends on, whether you know how to read the MRIs and make the diagnosis. And it's a simple diagnosis. And I'll go through it again. People who can't walk far, they have to sit down. They lean on the shopping cart. They can't get up the stairs without pulling themselves up the stairs. Yeah. They're constantly wanting to lean forward one way or another, whether it's just walking and just leaning forward to feel good because it opens up the spine. And that's what the spacer does. It maintains the spine open. People who, don't have vehicles, have to go to the supermarket. They steal a shopping cart. That's how they get back and forth from home.
That's right.
They walk wherever, they walk anywhere. You can go anywhere with a shopping cart, walker. These people have walkers all the time. And then you got the vain people who don't want to have a walker or a cane.
Yeah, but you're always taking pictures of a shopping cart just abandoned somewhere, and you're like, I know who took that. Yeah,
somebody in this neighborhood has spinal stenosis. What about the video that I sent you of a guy crossing Route 37.
That's right. That's right.
With an empty shopping cart.
Empty shopping cart.
He's got spinal stenosis. These are the people who can't afford or just too vain to use a walker.
Yeah.
You know, walkers are. And then they got those stupid walkers that makes you stand up straight.
That doesn't even make sense.
My father bought one. He bought one without even telling me. And I said, "Why did you buy it?" Because I want to walk up straight. Well, you can't. That's the whole purpose of leaning forward. You can't walk straight.
Yeah.
You know, people don't realize that. They think that you know, something to force him to walk straight will be better. No, that'll drop down his walking distance to half or less.
Right.
Or you just can't walk. You know, and my father doesn't have spinal stenosis. He's got another problem. He broke salute. He broke his back. His vertebral bodies, he had a compression fracture ×2.
Right.
And sometimes you just can't restore the height, and you end up leaning forward all the time.
Yeah.
It's hard to explain that to people, but you got the way to avoid compression fractures. You need to take care of yourself. You know, you need to make sure your hormones are good. You know, you should be proactive in all your exams, and not all physicians follow that stuff. You know, they don't periodically do, you know, bone density. Bone density tells you how much calcium you have in your bones. And if you know how much calcium you have in your bones, you can prevent a fracture. If you get osteopenia, osteoporosis, those of you who have it know what it is. You better not lift anything heavy. You better not fall on your butt, fall at all, because you'll break your back. And that's probably one of the worst pains you could have. I could tell when a person comes in looking at their face and they complain about the back pain that they have a compression fracture. I send them out right away for an MRI with a special stir technique. Shows you, lights up, recent broken back.
Wow.
And I fix them. I do a kyphoplasty. It takes very small amount of time. And it's very safe if you do it properly. But you could have a catastrophic complication, just like in anything else you deal with the spine. But the point is, it's worth the risk of fixing it.
Yeah, but it also it fixes that shattered vertebral body. Am I getting that?
Yeah, that it's shattered.
It's almost the epoxy that you put in there solidifies almost instantaneously, right?
Yeah, because it's you know, epoxy. You mix it with a catalyst.
Yeah,
it's like fiberglass or anything like that.
Sure.
You mix it, and if it's cold, it's in a cold environment. It'll take a long time for the chemical reaction to solidify. Just like anything else, you don't want to be fixing a car with fiberglass in a warm environment because it'll get hard quickly. So once you put it in the body, with the temperature of the body, high temperature of the body, it speeds up the solidification. So you get it in there quick, and within minutes, it's hard, and people usually get off the stretcher with no pain. The majority of people get off. Then sometimes it takes a couple of weeks. But you got to suspect if a person has one compression fracture, they can easily get another one. So when a person comes back to your office a week or two later and says, "You know what, doc, the pain felt good for like a day. Now it's just as bad as it was," you got to suspect another compression fracture, because it could happen. You know, especially you got, and it's not, I don't think there's any studies proving that if you do a kyphoplasty, it can create another one. But, you know, you feel so much better. You start lifting things up heavier and doing stupid stuff, then you can fracture another one.
Right.
You know, but you got to get to the source of the problem. Why are you falling too? Falling and spinal stenosis can happen too, because your legs get weak.
Yeah.
Anyway, back to the arthritis.
Yeah, I was going to say about the arthritis that, well, I mean, I know I have a cousin who's big into sports. You know, she always has been. She's in softball. She throws herself at everything. Okay, very physical, and she has you know, arthritis in her spine and that. So we're also talking to a lot of these mothers who are, you know, soccer moms, softball moms, and their kids get hurt and develop arthritis in their spine from the massive activity that they do on a weekly basis.
Yeah, but not real young. That comes up. I've seen it in their 30s.
Oh yeah, yeah.
That had you know, typical, you know, the way it is today, it's not like the way it was when we were kids. Like Little League.
Yeah.
Little League. I'll join the Little League. Never played baseball in your life.
Right.
You go down there. Some of them played with their friends.
Yeah.
But today they're training them like wrestling, all these sports, football. They're training them preschool kids.
Yeah.
And it's intense. This is what the parents do. But it's not just the parents; it's the coaches. They beat the hell out of these kids. By the time they're 30 years old, they got pars fractures. They're in their back. They got start to degenerate disc disease, the arthritis. The joints are starting to go.
Yeah.
They're not even matured enough to do some of this stuff. But it's so competitive, and everybody wants to be a professional that does these things, and they want their scholarship for college.
Yeah.
So they get hurt. They get hurt really easy. But anyway, the arthritis that you were just talking about, you've probably heard it before. Anybody that has bad back, it's called radiofrequency lesioning, ablation, rhizotomy. These are different terminologies of a specific nerve. Like what happens is you have these joints in your back that hurt. But you can't do anything about these joints as far as it's not like a knee joint, shoulder joint, hip joint where you can replace it. Because there's so many of them. You have two, one on each side from the base of your skull all the way down to the tailbone. And when they hurt, somebody discovered that there's a little nerve that comes out of these joints called the medial branch nerve. We heat those nerves up with a special needle hooked up to a generator that creates radio frequency. And we heat them up at 80 degrees Celsius for 90 seconds, and it stops that nerve from working. And then you have no more pain from that joint. Sometimes you have an extra nerve, but you go back and you take care of that nerve too. But it's a very successful. In fact, you had it too, right?
Yeah. Oh yeah. I get it. And it's been a while since I've had it last. It's been lasting a long time, but I usually know when I need to get it when I'm trying to roll out of bed, and you get all those grunts and oh God, and then
That's exactly what it is.
Yeah, you get to your feet and you're like, whoa, and then you have to walk around a little bit until work out your whatever, and but it's a nagging sort of pain.
I had a patient that I treated with the ablation or radiofrequency lesioning of the medial branch nerves. I heated them up, and they told me in their first initial evaluation that it's like a ceremony to get out of bed. Like first thing he does is wake up and take like an Aleve, ibuprofen or something like, I can't remember which one it was.
Yeah.
He lays there for about 45 minutes, and that starts to take the effect. Then he gets up and says by the time, he makes his coffee, has some breakfast, takes his shower, he's talking about an hour and a half before he starts to feel relatively okay.
Okay, yeah.
To get rid of his pain. Because when you have arthritis, a lot of times it hurts. Like if you sit for a long period of time, you sleep in the morning, it hurts, but then you start to move around and it actually rubs and it lubricates itself. And it usually lubricates itself with blood, which is a good lubricant.
Right.
I hate to say that, but then if you go too far, too much, then it starts to hurt again.
Yeah, and get inflamed and stuff. Yeah.
But this particular guy, I did one extra level because he had multiple, more than the average person. And he came back. He hasn't taken any more NSAIDs, ibuprofen, whatever it was. And he says he gets it up in the morning and has no pain.
Yeah.
I mean, this is how good it works. It was a great discovery. It was a game changer, like maybe 20 years ago.
Yeah.
But people still don't know about this.
And for me, it was like, it's horrible. When I come to you, it's bad. Because I can deal with a lot, and but I think it's like 2 weeks after the final radio frequency ablation, and it's like that. 2 weeks after, someone snaps their fingers and I feel better. I'm rolling out of the bed without a grunt. Any of that habitual stuff you do, like taking a leave and taking, and easing yourself into the day, you don't have to do anymore. You can just hop out of your bed, take a shower, and go.
Yeah, that's how it is. Some people have now the insurance companies, especially Medicare, has put some restrictions on it. Now, see what happens is the nerve tends to grow back. We tend to fix ourselves. The body tends to fix things.
Yeah.
So if you heat it up, what it does, you're not singeing it and burning it and completely destroying the nerve. Whereas you could do that, but it seems to grow back all the time, even if you do that. And some people it grows back in 6 months, some people 10 years, one extreme to the other. And we used to, I have a list of patients that every year or every 6 months they need a burn because it comes back, and it's not a big process. And if you do it within a year, the old rules for Medicare and insurance companies, you didn't have to do all the tests that you normally have to do. It's a pain in the butt. You just burn the nerves, and you're allowed to do it twice a year. Now you can't. And then if you do an upper level, they only give you're only allowed to do like 3 nerves on the bottom, right? Or the top, wherever it's worse. But then if that doesn't work completely, then you do the upper levels. Now they eliminated the ability to do that.
Oh, Jesus.
So what happens if somebody has spine pain from arthritis and they only pay for half of it and they need the other half done? It's a shame that, especially Medicare or any other patient, they need to pay for it out of their pocket. Why do they have to pay for it out of pocket when it's obviously a pathology that needs to be treated?
Yeah.
I don't understand sometimes. I'm sure that's not going to be forever. It was just a recent change in the rules. But, in the societies are all fighting it now, all the pain societies, because it's a ridiculous rule.
Yeah, good.
I got a patient that I can't do it. I used to do him religiously every 6 months because he's a hard worker. And the guy's in his 70s. And he would do great. Well, guess what? I couldn't do it. And I find out that he went to another pain doctor because I didn't do it. And they asked for his reports. And this is my patient for 20 years, right? So, I mean, like as if he's going to go to somebody else and they're going to do it they're not going to do it for nothing,
Right.
I mean, I've done stuff for him for nothing because he just needs a little bit more than what the insurance company pays for. And I don't send the bill out because I'm not going to get paid. But I've done him this favor. I don't know whether he's not bright enough to realize that the main reason why we can't do it is because the insurance companies don't want to pay for it.
Right.
But what are you going to do? He'll be back.
Yeah, it's the patients that are hurting, though. That's the sad thing.
As soon as they tell them, listen, you already maxed out on this procedure.
Yeah,
we can't do it. Dr. Jasper's right.
I've been there in my treatments where I've maxed out because this is before you, but I've maxed out, and the very little I would have gotten from someone else, I'm told no, like no relief for you,
Well, because like epidurals, now we're allowed to do 4 a year on one particular level. It used to be 3, so they improved that to a certain extent.
Yeah,
and I guess you got to put limits on it because some doctors just don't realize that if you do too many epidurals, you can hurt somebody.
Right.
We make sure we measure how much steroid the person gets, their size, their weight, and their side effects, and we put that all into the equation, and we don't give more than needed. But like you said, people might need a certain amount of injections because they feel good. But if they don't feel good more than 2 months, then you can't do that. You got to go to the next step.
Right.
And what happens is, what happened to you? You ended up going and get some kind of spine surgery, laminectomy or hemilaminectomy.
Yeah. Nobody would touch me either. Like for the longest time, because I was messed up, or they thought I was addicted to pain pills. I got that because I was going to pain management doctors, and that's all they gave you. And then I finally got it from you, and that's if you're suffering from arthritis in the spine, and you know how bad it is if you have it, okay, finding someone like Dr. Jasper who does have what's it called again? Procedure. I'm going blanking out on words, but he does have a procedure to fix it. Holy cow! You hold on to that doctor because it's like life and day difference for the person who's living with pain. He can take that away, and you don't have to deal with it anymore. That's just how simple it is.
Unless the nerve grows back.
Unless it grows back, yeah. And then you go again. I always call that a tune-up when I come in to see you. Like the nerve grew back, doc. I need a tune-up. Yeah.
Give me a tune-up.
Give me a tune-up, and I'm good.
Talk about a tune-up. We're doing it's like a tribute to Paulie Walnuts.
Paulie Walnuts.
But you know what? He's not the only guy that died. You got a bunch of guys that died.
A bunch of people died.
I wish I could remember everybody's name. You got Ray.
Ray Liotta. Yeah,
Liotta died.
That was very upsetting. I mean, you guys out there may have known him from Goodfellas. He was in.
Guess who? You know the boss in Goodfellas. He just died.
Jesus.
What's his name? I wish I could remember everybody's name.
See, I said once. You know, all our heroes are dying, and there's no one on the horizon to replace them. You know, it's just sad.
And there was another one that died. It was like 4 of them. But anyway, I guess should have been prepared with their names.
I'm going to get it in a minute.
But you know they're entertaining. A lot of Italians, like for example, my father did not like Sopranos. He thought they were making fun of the Italians and making it look like all the Italians are like that. You know, which I agree to a certain extent. Yeah. It's not true. In the majority of the Italians, you're talking about the people that are connected, the wise guys, and there's very few of them today. Yeah, because they want you to think that they're not around. You know?
So we got Paul Sorvino.
Paul Sorvino, he was the boss. Yeah, he was the one cutting the garlic in jail.
Right,
Goodfellas.
Yeah, Paul Sorvino. I mean, there's so many. There's so many that died
within the last couple months.
Yeah.
They're entertaining. But we're gonna have Felix here tonight. Don here. It was kind of like a Goodfellas show.
Yeah, we got to get them in definitely one day. Yeah, because that's going to be great. Adding Don into the mix is fantastic.
So the heat Felix is coming down. Don's already down. My father's down. We're gonna have a joke off weekend. A joke off.
Right.
Now we sit around, have a couple drinks, and maybe smoke a cigar and tell jokes.
Oh no,
Felix.
I forgot about this one.
Who's that? Oh yeah,
James Caan.
James Caan.
That was crushing.
Yeah,
that was crushing.
He always looked younger than he is.
Right. He was in The Godfather. He was what Tony?
He was Sonny.
Yeah, Sonny. That's it. Yeah,
He's the one that got killed at the toll booth.
Oh my God.
They set him up for that one.
That's like a cinematic masterpiece, like, you know, and that scene with Sonny getting gunned down, you know, that's in cinematic history, man. That's great.
Leave the gun, take the cannolis. Leave the gun, take the cannolis.
Vinny, what was it? Vinny, who's the guy who sleeps with the fishes? What was his name?
Oh,
Lou Brock, something like that.
Pussy. Their name was Pussies, right?
No,
the guy in the show, that was his name.
Big on Sopranos. I'm talking about Godfather. It was Luca Brasi sleeps with the fishes.
Yeah. Anyway, so a little bit more about the pain. We had quite a few success stories, and we have a new doctor coming in. Is going to help us out. We got Dr. Skoblar, who's been there. He's very successful.
Oh yeah.
He started to build up his patients, and the patients all like him.
He's very big on his relationship with his patients too. So for those of you out there that think the doctors never spend enough time with you, come see Dr. Skoblar. You know, he'll give you that time. So will Dr. Jasper. But we talk about Dr. Skoblar because he's just he's really changing up the place, you know, and people are starting to hear about him, and they're curious, and they want to come in and see what new techniques he's bringing to the practice. He's
got a lot of new techniques. Yeah. I do all of those techniques too. Yeah. But he seems to love them.
He loves them. Yeah.
You know, I do the big cases, which they're never really big cases. But in our practice, they consider the bigger case. For example, the Minuteman, which are the spacers, endoscopic surgery, and he does a lot of the nerve blocks and the ablation of the nerve blocks of the knee. Yeah. You got severe knee pain, can't have surgery. You don't choose to have surgery. He can block the nerve so you don't feel as much pain or feel no pain at all. But I do and he's learning the bigger. That's one of the reasons he came on board. He wants to learn the big procedures. But so we got to pray. And by the way, you know, I know really, really good surgeons. I'm not going to mention any names now.
Right.
That work very closely. When I say surgeons, I say surgeons who do major spine surgery.
Mm.
And I'm totally against.
When you say that, you mean the full open back?
Full open back,
Yeah.
traditional fusions.
I got to. Oh yeah.
You know,
Yeah,
and
yeah,
when
yeah.
I say I've got a couple surgeons that are very conservative, that I trust, that are not going to do unnecessary surgeries, because there are unnecessary surgery. You can't just send somebody to a surgeon because they're the surgeon for the Jets or for the Giants or something.
Right.
You know, it doesn't mean they're that good.
Yeah.
You know, they do old stuff,
Right.
which they don't do anywhere in the world. And I'm not naming anybody particular, but surgeons are surgeons. You know, just like any other field, you have to trust them.
Mm.
They got to be honest. And the majority of all doctors, the majority, way up in the 90 percentile, are honest. But you have a few of them are dishonest, and that's why you have these problems today with the insurance companies making you not do certain amount of certain things, because certain people take advantage of it and they do more than you're actually supposed to do.
Yeah.
You know, for the money. And I hate to say it, but that happens.
Yeah.
So you got to trust the doctor you're with, and you got to, if you trust the doctor, in other words, I have a lot of patients that trust me.
Yeah.
And I give names to other doctors that I trust. And you just have to have somebody you can hang your hat on. Even your family doctor knows doctors that are honest. But do they know much about surgery and spine surgery? No, they're just in the dark as any other patient, layman. But you get somebody like me or any other interventional pain doc that does the minimally invasive spine surgery and has studied abroad, like me. I mean, I've studied in Korea, all over Europe, you know, Italy, France, Germany, Holland, Austria, Switzerland, you know, all over. I can name all the countries out there, and also South America, you know, Brazil. You know, these guys are doing all this stuff all over the world. But these guys, they're all doing it in China. Like I said, Korea. I've been to Korea.
Hey, I studied abroad or two myself. Joke off. Bam.
Joke off weekend. Abroad. I studied abroad a couple times. Anyway, that's how you learn how to do it. And when you're exposed to what's really going on in the world, you realize that this country, and I'll say it again, quotation, this country is the most backward country in the world when it comes to spine surgery.
Right.
Because there's a lot of unnecessary spine surgeries going on. And I didn't say they're all doing it.
No.
You do have the surgeons that.
But like with everything, there's always a couple of apples that spoil the bunch, right?
Yeah.
You know,
interventional pain docs are the same thing.
Yeah.
You know, we're talking about this field of the spine. You know, they're doing injections that they don't even know how to do, that don't work because they don't do them right.
Right.
I teach a lot of these guys how to do the more advanced procedures, and they can't even do the simple procedures, but they've been working for 20 years.
Yeah.
You know, but what are you going to do? You know, you got to be able to trust the doctor, you know, especially if you're not getting results.
Yeah. I mean, that's the least you feel you need to be able to do when you come into a new doctor. It's at least trust in his education, trust in his skills, his experience, you know, and you know, you need to find somebody that you really truly can trust. Dr. Jasper is one of those. You can make an appointment with him. You can call 732-262-0700 if you want to make an appointment with Dr. Jasper. We do a podcast. We try to do them as often as we can on the weekend. Same bat time, same bat channel. So that's going to be from 10 to 11 on Saturday mornings. But we're just so glad to have Dr. Jasper today.
Well, thank you very much.
Yeah.
I also want to talk about reviews. You said something that just stimulated that topic.
Yeah.
Lately, we've been. It's funny. It's funny that you know who does a review. Somebody pissed off.
Yeah, somebody pissed off.
You know who doesn't do a review?
Somebody who's super happy.
Yeah, somebody's super happy.
Yeah,
that
content.
thinks you're the best, a miracle worker.
Right.
They don't. So now you get this list of. And by the way, anytime you see really good reviews, it's because they're almost, you know, at gunpoint giving those reviews. And when I say at gunpoint, not that they don't want to do the review,
yeah,
that people don't want to sit there and do it. You know, they don't have the time. You know, they're feeling good now. They want to go out and party, and go
Enjoy
outside,
that feeling
enjoy
good.
the life.
Yeah, yeah.
So what we've been doing is also you and a company that we have, and Gabriel, especially at the office.
Yeah.
They're helping them go into Google. They don't have, most of the people don't have a Google account, but you go into Google, you give a review on anything.
Yeah.
You know, especially if it's a good review. You know, if
And-
you have a bad review, please do me a favor, don't put it.
Yeah,
on.
yeah.
And I do have some bad reviews, and we need more reviews. And why do I have bad reviews? Because people complain that they have to wait. I've seen reviews on there that I've got rid of patients' pain completely, 100%, and they give me a bad review because they had to wait an hour or 2 hours to see me.
And they get all sore under the collar about it, so they start looking for other things to be pissed off about. You know, it's not a real genuine testimonial at all, because it's fueled by emotion alone. So maybe you had a bad day that morning. You know, you got up and now the whole world seems to be against you. Well, screw the world.
I wouldn't talk about. I never have a bad day.
Yeah,
So
well, I mean, other people, you know.
Oh
yeah. But you know, and it's a shame because it's these doctors that are they're working irregardless of whether they get a good review or a bad review or any review at all. But they deserve it. You know, the hard work that you put in, the care. And
it used to be all word of mouth.
Yeah.
Now you got this internet, and most of the people a lot of people that have it don't even know how to get on the internet.
Right.
So if anybody's out there that had a good experience with me, I'm sure there's a lot of them. You know, throw something on Yelp, throw something on Google.
And in the office, we're trying very hard to create a system where it'll be very easy for you. It's almost a checklist, you know, and then you can add a sentence or two. And then poof, that's it. And then you're on your way out. It's very fast and it's very kind. And we like that.
Well, you know, we've been trying electronic medical records.
Yeah.
Not right away. You know, I'm kind of old school.
You got to ease yourself into that stuff.
I'm not a 35-year-old doctor just coming out.
Yeah.
So I've been around doing handwritten notes. When I started, it was all handwritten. Then we went into dictating. Sending the dictations out to India or some other country, and by the next morning would be all sent back, and we put it in the chart.
Right.
So we're in the process today, and we're talking a few years now that we've been trying to do this.
Yeah.
You know, we did have one type of electronic medical records was a pain in the butt.
Yeah, that wasn't.
And now we have one that's supposed to be pretty good. You can actually dictate while you're seeing patients, which I don't really agree with, but we're still not up to par with that.
So, no, we're always trying to make things work smoother, make things better, put stuff into place that's better for us, better for the patients, you know. And any way you can whittle down the work and still get that super positive result. It makes the nurses happy. It makes everything happy.
You know, electronic medical records. You get in there, it's documented, the date, the time, you put everything in.
Right.
Whereas, you know, we write notes, and we write a note, you know, we put the date on it.
Yeah.
You know, and I sign it, right? But medically, legally, they want to see today what time you signed it, how much time after you did the procedure you signed it. You know, I mean, it's what the world's coming to today. It's like nobody trusts you. Like, oh, you signed this after you made a new copy. Oh, you know, it's stupid stuff.
It's like an insurance company's version of a speed trap.
Yeah, it's
right.
ridiculous.
Yeah. Then they're looking to flag you for anything they possibly can. It's not right. It's not right for good doctors that are trying to, they're trying to do the best for their patients constantly. Dr. Jasper is constantly looking for new procedures, new everything. If they work and he can trust them, he's going to bring them to his patients and take pain away from as many people as he possibly can.
Well, I have a surgeon that I work with. I got a surgeon that I work with, and he came up with this. Well, he's usually emails my son Phil, and he says, "I got a new procedure that's state of the art, minimally invasive. Can we have the rep come down and explain it to your father and see if he likes it. Absolutely.
Sure.
I mean,
Yeah.
that's the industry. Doctors, researchers, scientists, they try to invent new stuff to make everything better, easier, less invasive, and safer, faster, save money. I mean, this is the name of the game, right? Mostly easier, more efficient, and less invasive. That's what we want.
Right.
And I constantly have companies coming in and showing me these things. Some of them are good, some of them aren't. Somebody's trying to make some, invent something, make some money, and it's not worth the effort. It's not worth the risk.
Yeah.
They're out the door. I don't throw them out. I'm polite, but sometimes you come up with they come up with. I wish I could invent one myself, but
Well,
I have some
so many
ideas.
times you've seen a product and you're like, boy, if they just did it this way instead, and this would have been better for you, like this would work.
Yeah,
You
and
know,
they usually do it. And
Yeah,
they
yeah.
take the credit. They take the credit. But I got no time for that. I take care of patients, and when I'm not taking care of patients, I'm having a good time.
That's right, man. That's right.
Play hard, work hard. That's what I say.
Yeah.
This ain't no dress rehearsal.
So we got about 10 minutes. Let's.
Can anybody call in or anything?
Yeah, they actually can call in. Hang on.
Well, do they have a number?
I'm going to give it to them in a second.
Anybody has any questions about their pain, or friends of theirs, family that have pain, that are afraid to come in and see me or go see anybody, and you see them suffering, you can help. I had that all the time, and they bring them in, and they still don't want it. They don't want to be there, these patients. They don't want any help. But if the family members sort of convince them, I look at the MRIs, I tell them what they need, I tell them their options, and they can take it or leave it. I don't force anybody to do anything. I don't talk anybody into anything. My job is to show you what is wrong with you, what's causing you to have the pain, and your options to get rid of the pain. And you can't force anybody to do anything.
Right.
But once you get rid of the pain, then they're happy. But sometimes it's like jumping off a high diving board. I had a patient yesterday that I went through the whole thing. I spent a good 45 minutes with her, and she goes, Doc, I'm going to really think about this. It was a simple procedure. It wasn't anything big. She never had anything done ever. But she's had pain for 15 years.
Yeah.
So I said, well, that's no problem. You take as long as you want to make a decision. I said, but it actually makes me a little relieved, the fact that you have that attitude. How come, Doc? I said, that just means that your pain is not that bad. Because if your pain was bad enough, you'd say, when can you do this?
Nothing
Now?
would stop you.
Nothing would stop it. So that's good. Now you know what's wrong with you. I showed you on the MRI. And if one day you just don't want to have that gnawing pain that you live with every day,
Right.
if you wanted to see if we can get rid of it, give us a call.
Yeah.
And you just schedule a procedure. But if it's over a month, you can't schedule a procedure. You got to actually come in and see the doctor again.
Yeah.
Because they don't, the insurance companies frown upon that. I don't know why.
Yeah.
But it might be safe to a certain extent.
But that's another thing that you get slack for, or backlash for in some of those reviews we were talking about. A lot of it, your hands are tied because of the insurance companies, and patients get pissed off and about something else, and then they go after that. They don't even cover this, and they don't take that, and stuff.
And sometimes you got to jump through hoops to do one procedure.
A
procedure that is going to work, but you got to do all the other ones as a prerequisite. And the experience that I have, they're not going to work sometimes.
Right.
Most of the time, they're not going to work, but we got to do them anyway.
See, I always felt as a patient, everywhere I went, the first thing they would introduce is the epidural, and you're like rolling your eyes, like, I've had these 1,000 times. I'm looking for somebody who can actually take away my pain. Well,
that's an attitude that everybody has. Go ahead.
No, and I was going to say, like, can you do something that will actually help me? So yeah, we talked about epidurals at the start of the show, but yours are different in the way you use them, or a specific way.
It's always hard for me to say this, but when I hear that, sometimes patients like, if it's an epidural, I'm out of here. I'm like, okay, well,
Oh, so you have heard that? Yeah, yeah,
Right?
yeah.
You hear it all the
Oh,
time.
yeah.
People are like, I had 100 epidurals in my life. It's not going to work. And chances are, if it's spinal stenosis, it's not going to work.
Mm.
So you got two scenarios here. You got one that it's not going to work, but they haven't had an epidural in 5 years, and the insurance company will not let you put in a spacer unless you failed epidurals within the last year. So you're almost forced to do it anyway.
Right.
And then I've had patients like that I put an epidural in them, that they've had tons of them, haven't had them for years, and I do it, and they're like, good.
Yeah.
They're like, doc, how come your epidural worked and the other epidurals never worked? And it's a question of being able to put the needle where it belongs.
Yeah.
Right. Strategically steer the needle right to where it's supposed. And you're talking within 1/8 of an inch where it's got to be.
And I remember the first time you told me about all that, that you would teach other guys how to do it, right? And it would be like they jab the needle in, and how am I? And you'd be like, well, you got it in good, but you're nowhere near where you're supposed to be.
And I give them three. I give them 3 tries. And you're talking about somebody I'm teaching them advanced procedures,
Right?
And they can't stick a needle in.
Yeah.
How are you gonna do advanced procedure if you can't stick a needle where it's supposed to be?
Right.
You're doing advanced procedure somewhere where it doesn't need a procedure.
Right.
Right. I mean, we're not gonna fake this. So I tell them you got 3 tries. If you can't put it right where I want you to put it, then you're gonna have to go home and practice on an orange or something.
An orange.
No, they don't even practice on an orange. These are doctors. These are doctors who have been practicing for years.
Right.
5 years, 10 years, 20 years, and not like my office or my OR. Everybody knows where the tip of the needle is supposed to be. And we talk about this on the show.
Right.
The X-ray tech, the nurse scrub tech, the nurse, circulating nurse, the anesthesiologist, they all know that needle is supposed to be. So when somebody comes into the room that's doing the procedure,
right,
and it is not me, they all pay attention. Right? And then if I'm not there, one of them, one at a time, would come up and say, doc, you
didn't do that right.
He or she didn't put the needle anywhere near it's supposed to be. And I said, well, what are you going to do?
Yeah.
You can't punch them out or anything.
Right.
But and it's also not only skill, it's the type of medicine that they use.
Yeah.
Some of them, I go to these conferences, what do you use? And I tell them what I'm using. That's expensive. Why don't you use this stuff? I said, it don't work. But it's like, you'll be paying half the price, and half the price over a year span could be like $150,000.
Yeah.
I said, yeah, but when it doesn't work, and that $150,000 worth of patients go somewhere else, guess what you're losing?
Right.
A lot more than just, the money that you lost from putting extra money in for the good medication.
Right.
That $150,000 is worth it, because guess what? You're satisfied because the patients are satisfied.
Yeah.
So you can't just, you get what you pay for.
That's
you buy cheap medication, it works like cheap medication.
Right.
You buy a cheap car, it drives like a cheap car.
And who do you like? You remember that commercials on TV? What's in your wallet? Right.
Yeah.
Yeah. Well, like, where do you want your pain physician to save money when they're working on you?
Yeah.
Right. Like, where do you want them to save the money? Because you think you're getting the best treatment or the best stuff, but where would you like them to save money on you?
It's not, hey, listen, I got C-arms. I got 3 C-arms,
right,
which are live X-ray machines that all of them cost like $150,000.
Yeah.
You know what kind of nice car I could have bought for that?
Oh, I know.
An airplane or a helicopter?
Yeah.
But, sometimes my priorities are different.
Right.
When it comes to, when I started buying all my equipment for the OR, like the lights in my OR. The lights in my OR are $200,000 more than the standard lights in the OR, because I don't want that glare. I want when I'm looking at something, when I'm operating, I want it to be crystal clear.
Yeah.
Some of these lights, they have this beam go down, and when you stop operating, you can't walk out of the room because you got this bright light glow in your eyes. You're gonna walk into the wall. You can't see anymore.
Yeah.
But and they were like, how come you're spending so much money? Listen, if I buy a nice car, I'm going to spend the money.
Yeah.
I buy a nice machine, lights, anything for my office. I want the best.
Right.
Like the ultrasound machine. We just bought a pretty good ultrasound machine. I could have bought a cheaper one, but it doesn't have the capabilities, and the imaging is not as good. Why would you want to do that?
Yeah.
Eventually it pays itself off. But, you got some people just can't afford it. Can't afford it. But there's always deals out there with these companies. Like you can lease them with $1 buy at the end.
Yeah. Yeah, so we were 1 minute in, so we should probably
Why somebody coming and gonna do a show?
wrap it up. Yeah, Dr. Barbara Schneider's up next.
She is?
Radio Free America with
At what
Dr.
time?
Barbara Schneider.
11 o'clock?
Yeah, 11 to 12 every Saturday morning. You can catch it on Dr. Barbara Schneider's Facebook page or Radio Free America with Dr. Barbara Schneider on YouTube and Rumble.
So what do you think? You think we should make this consistent every Saturday when I'm around?
Yeah, I'd like that.
So that people can look forward to seeing this. I tell my patients.
Because they do miss you.
They miss us on that. Is it still going on at 5 o'clock in the morning on Sunday?
Oh, yes, it is. Yeah, Paul will be downloading this and putting it up tomorrow.
Oh, good. So
yeah,
you can listen.
I've been in constant contact with him. Yeah,
you listen to me on the radio tomorrow morning at 5 o'clock if you have nothing to do.
Yeah, if you got nothing to do, you have insomnia like me. I'll probably be up listening to us. Yeah.
Well, thank you for everything. Everybody listening to me, come and see us at the Jasper Spine Institute at 74 Brick Boulevard in Brick, New Jersey, right behind the Roy Rogers, across the street from Burlington Coat Factory, which is still there, right?
Burlington, I think it is.
A Stop and Shop.
I
think it's Bank of America's across the street. But we're there. We're going to help you. We're going to do the best we can. We got a great crew there. We got the A-Team.
The A-Team.
The A-Team's there now. Well, thank you very much. Have a great weekend.
Yeah. For more information about Dr. Gabriele Jasper and all the wonderful things we talk about on his show, please go to jaspermd.com. And to make an appointment with Dr. Jasper.
Paulie
Walnuts. There he is. All you have to do is call 732-262-0700. Thanks, everybody. You take care of yourselves.